Okay, we're back at it with the House Appropriations Bill hearings. We are now moving to House Bill 1540. Delegate Harrison.
There we are. Well, good afternoon, colleagues. And I'm going to say, Madam Chair. For the record, I'm Delegate Andrea Fletcher Harrison, here to present HB 1540, University of Maryland Capital Region Medical Center funding the repeal of the termination date. HB 1540 repeals the termination date on an annual state operating grant to support the operations of the University of Maryland Capital Region Medical Center, the flagship hospital of the Capital Region Health, part of the University of Maryland Medical System. Before I get into the need for this legislation, I need to share some history that makes clear what a feat that sentence represents, what it took to get to the place where where healthcare delivery sits now in Prince George's County. UMCAP region is the largest hospital in the second largest county in the state of Maryland. Prince George's County is home to almost 1 million residents in a state of 6 million. Still, while Prince George's County today has 4 amazing inpatient hospitals and a growing healthcare delivery system, our hospital's collective footprint is still much smaller than that of comparable jurisdictions. We have a total of 677 inpatient beds compared to 1,384 in Montgomery County, 3,663 in Baltimore City. It's 2,172 when you subtract the large statewide academic medical centers. Those 677 beds and the growing healthcare delivery system that surrounds them were hard-fought resources. I don't know how many people have been around very long in here, but it was a very long, hard battle for us for many years. As a member of the Prince George's County Council from 2008 to 2018, I had a front row seat to the work that went into preserving and now transforming healthcare in our county. As a member of the Dimensions Board, which was one of the last county-owned hospital associations, it is still difficult to remember the times when we only had 1 day's worth of cash on hand, still had to pay employees, worry about whether or not they would be there the next day, operate a level 2 trauma center system, which is the busiest in Southern Maryland. What we see today would not have happened but for the transformation of a historic public-private partnership among the state. The county and the University of Maryland Medical System that began in 2011 with an MOU pledging to work toward the goal of transferring the last county-owned hospital system in the state to University of Maryland Medical System, a private, not-for-profit health system that includes 1 of 2 academic medical centers in Maryland. With very little certainty around whether the effort to preserve and grow healthcare in the county would ever be successful, the county and the county delegation again and again, year after year, made investments in restructuring the healthcare system its #1 priority. If I had an hour to testify, I could at least begin to detail the work and commitment at every level that contributed to what we see in Prince George's County today and what the amazing physician leaders next to me represent, but I will be respectful because we have been here a very long time today and sitting. What I do know is this operating grant remains necessary to operate the Regional Medical Center and support the clinical programs that represent unique, life-saving resources to our county, the region, and the state. The bill does not change the purposes for which the state and county funds may be used. Those funds must continue to support the transition of Prince George's County Regional Medical System Center into University of Maryland Medical System and may only be used to increase access to critical healthcare services, improve the quality of care, and facilitate cost containment measures that prevent additional operating losses. The underlying statute also continues to require Prince George's County's significant capital commitment, $208 million for construction of the facility, with the state matching those capital funds as previously enacted. HB 1540 respects and reinforces that shared state-county partnership. For Prince George's County and the broader region, the Capital Region Medical Center is more than a building. It is the backbone of our local healthcare system. It is a trauma resource, a major employer, and a key component of our efforts to address longstanding health inequities in majority Black communities that have historically faced higher rates of chronic disease, maternal mortality, and barriers to specialty care. Measuring predictable ongoing state support helps maintain high-quality clinical programs, recruit and retain top medical staff, of which we have here, and sustain the services our residents depend on, from emergency care to specialty services. I want to thank you all for your role and that you have played and continue to play in the transformation of healthcare in our county. Colleagues, I really want to thank you for your time, and I respectfully request a favorable report on HB 1540 so that we can safeguard the state's investment, uphold our commitment to Prince George's County, and ensure continued access to high-quality care for the residents of the Capital Region. Thank you for your consideration, and I'm going to turn it over to my panel, which I forgot to say were already here with me.
Well, first of all, I want to say thank you, Delegate, for bringing the bill, and just welcome to the witnesses today. Just want to remind you, we have 2 minutes per person. Thank you so much. Yes,
thank you, Madam Chair. And on that note, I'm going to do a little speed reading. Good afternoon, Madam Chair, members of the committee. For the record, Kristen Jones-Bryce, Chief External Affairs Officer for the University of Maryland Medical System. I want to start by thanking Delegate Harrison for her sponsorship of HB 1540 and her commitment over the past almost 2 decades to evolving and improving healthcare delivery in Prince George's County. For years prior to the formalization of the public-private partnership that Delegate Harrison referenced in her testimony, the health system in Prince George's County, then known as Dimensions, was struggling to stay afloat. She reviewed some of the financial challenges that the system faced, but it wasn't just financial challenges. Over time, county residents suffered from higher rates of death from heart disease and cancer than those in neighboring jurisdictions, and more than 60% of Prince George's County residents who required hospitalization in any given year received that care in a hospital outside of the county. This is the system that state and county leaders endeavored to save. The effort required long-term vision and considerable investments of both time and money. The turnaround stretched across the administrations of multiple governors, multiple county executives, and multiple medical system leaders. The choices that were made mattered. State and county leaders very intentionally chose UMS, an academic medical partner, capable of growing high-quality clinical programs, and the charge they gave us was clear. Transform healthcare delivery in the second most populous county in the state, and do so while also creating cost efficiencies that addressed a historical structural deficit of over $50 million. Today, under the leadership of President Nathaniel Richardson, UM-CAP region is run by an incredibly talented team who believe in the work and who believe in and work toward their mission every single day. Today, the number of Prince George's women choosing to give birth at UM-CAP region has doubled. UM-CAP region is consistently ranked in the top 10% of hospitals nationwide for excellence in cardiac surgery by the Society of Thoracic Surgeons. Today, UM-CAP region is proud to be the home of the only and second busiest trauma center in the country. With that timer, I will thank the committee for their time. But I also just want to say quickly, it's not just CAP region that has benefited, but there is a growing healthcare economy in Prince George's County that was seeded by that investment. And as you heard the comptroller talking about the loss of federal jobs, I think that's really important right now for our state. So thank you. I'm going to switch seats with Dr. Gray. There's me.
Cool. Am I going next? Okay. Hello, everybody. Madam Chair, everyone here, my name is Jamie Brown. I'm a cardiac surgeon. I've worked for the University of Maryland for 25 years. I came to Dimensions Health, now University of Maryland Capital Region, 13 years ago, and then started, I guess you would call it, reinventing the cardiac surgery program by plowing through some instruments that seemed to me very old. Long story short, my first patient, the conversation went kind of like this. Not my dog, Dr. Brown. Now fast forward to that, 1,200 patients later, a cardiac surgery program that got awards for safety and outcomes, 1,200 patients and families, I should say. And I think the transformation has occurred. Step one, of course, was clear. We have to create some trust. And we create trust by being safe and being clear and communicating and hiring excellent people. This all happened in the old hospital. With the move to the new hospital, we now have excellent people, excellent teams across the Heart and Vascular Institute providing life-saving care. And to emphasize that point, based on utilization rates which are conservative, out of this population of 900,000 people, we probably could do 1,500 heart operations a year, which prevent death. That's what I do. I take a risk or put a person through a risk and prevent death. To do this has been quite the journey, as you've surmised. It's across the whole hospital, the services that have been rolled out. You'll hear more shortly. But thank you for the support to date. It wouldn't have happened without it. It wouldn't have happened without the over-the-top commitment by a collective of individuals. It's been amazing. The whole thing was appealing from the beginning to see the partnership and the need in the population. So I hope that you will continue the support.
Good afternoon, Madam Chair, members of the committee. My name is Melissa Weifhaus. I am the Medical Director of Radiation Oncology at the University of Maryland Capital Region Medical Center, and I'm here today in strong support of House Bill 1540. I have been practicing as a radiation oncologist for 7 years now, and though I have only been at Capital Region for 2 years, I actually grew up in Prince George's County, attended the University of Maryland for medical school, and currently live just 15 minutes away from the cancer center. I remember as a kid helping my family members with cancer navigate through their cancer in our community. At the time, cancer care was so fragmented in Prince George's County. We had to travel all over to obtain lab work, images, and meet with various specialists. I am thankful to this committee for having the foresight to help establish a cancer center at UMCAP Region that eliminates the need for patients to travel far for their cancer care. In one convenient location close to home, we have surgical, medical, and radiation oncologists and advanced imaging and specialty care teams to serve our community. Having cancer resources under one roof reduces delays in patients receiving treatment, which often translates to improved cancer survival. Despite the progress here at UMCAP Region, there remains a lot of work to be done. For example, in the past couple of weeks, I have emergently treated at least 3 patients for very advanced disease emergently with radiation to stop their bleeding. Last week, 2 women came in with severe back pain. Both had cancer in their spine, pushing on their spinal cord, both requiring radiation and surgery to alleviate. We see a high number of Black men diagnosed with aggressive advanced prostate cancer who come into our hospital with severe bone pain and other emergencies. My vision, in fact, our vision, is to stop the diagnosis of cancer in emergent settings, promote cancer screenings so we diagnose cancers early, and maximize cure. We are changing the narrative of healthcare in Prince George's County, becoming a reliable, compassionate, and equitable resource for cancer cure at UMCAP Region. For these reasons, I urge the committee to vote favorably on HB 1540. Thank you.
Hi, good afternoon, Madam Chair, committee members, distinguished guests. I am Dr. Donna Neal, and I'm here today in strong support of House Bill 1540. Thank you for the opportunity to meet with you. I specialize in maternal fetal medicine, so I treat women with medical problems during their pregnancy, women with a history of a prior poor pregnancy outcome, women with an ongoing pregnancy that's challenging, and fetuses with high-risk conditions that have been identified in utero. While working at another very large academic medical center in Maryland, I noticed two phenomenons. One, women were leaving Prince George's County for their obstetrical care. And two, more and more patients and their partners were afraid to either start a family or to expand their families for fear of a significant complication during a pregnancy or even maternal death. Both of these phenomena are unacceptable. No woman should have to leave her community for high-quality care, and a woman who wants to be pregnant should not fear an adverse outcome. It was shocking to me that there were maternity deserts in the second most populous county in our great state of Maryland, and that these deserts were in the most populous African-American county in the country, which is significant given that Black women are 3 times more likely to die in childbirth than their non-Hispanic white counterparts. So in April of 2023, I joined the Department of OBGYN and Reproductive Sciences at the University of Maryland School of Medicine to help address these deficits in access to maternal fetal care, and UMCAP became my clinical home. In less than 3 years, we have developed a diabetes and pregnancy program where over 250 women have undergone comprehensive diabetes care during their pregnancy, a fetal echocardiogram program, which is so crucial in that the most common anomaly in fetuses is congenital heart disease. So we need to make the diagnosis early for counseling and appropriate care postnatally. We've developed an initiative for outpatient management of anemia during pregnancy to reduce the need for transfusion during delivery. We've developed a food as medicine program for our patients where they are provided specific foods to treat their diabetes, their anemia, and their obesity, and a postpartum hypertension program to reduce postpartum readmissions, which we've done by 80%. All of this is on top of a vigorous severe maternal morbidity review program, extending the current programs that were already in place, and all being done without increasing the cesarean section rate in women having their babies for the first time. I just want to end that in 2026, the University of Maryland Capital Region was named by U.S. News and World Report as a best maternity care hospital and a maternity care access hospital. And this designation is only given to hospitals that meet rigorous national safety and quality standards while providing essential high-quality care in communities impacted by maternity care shortages and healthcare deserts. So I'll end now because I heard the buzzer go over. I really appreciate this opportunity to share with you, and I appreciate your continued support of House Bill 1540. Thank you.
Thank you for your testimony. I mean, you guys are doing literally life-saving work, and that's really why I gave you 30 extra seconds, because you're healers and lifesavers. But thank you for your testimony. Are there any questions for our witnesses? Delegate Spiegel.
Thank you, Madam Chair. First, let me say, Delegate Harrison, thank you for your determined advocacy on behalf of this important cause for the county and for the whole state. And congratulations to everyone involved on the incredible progress and success that we've seen in recent years. I mean, it's really an amazing story to tell. Obviously, the focus of UMCAP region has been on these advanced patient treatments, maternity care in terms of filling that need. But Ms. Bryce did mention the economic impact that it also provides to the entire community. I was just curious, I know this is a question I've raised with in the past, and I just wanted to know if you had any thoughts on how robust the partnership between UMCAP region in particular and the life sciences industry around the Capital Region has been in terms of providing clinical trials at the hospital and other opportunities for partnership.
I can take that. I was going to talk about clinical trials, but I only had 2 minutes.
I'm giving perfect. I'm asking you about it. So you have more time.
Yes. So we have a very strong partnership with the University of Maryland Comprehensive Cancer Center, the Greenbaum Cancer Center in Baltimore. And I am an associate professor at the School of Medicine, and I do a lot of research. A lot of my research focuses on cancer inequities and ways that we can have practical clinical solutions to mitigate them. And that's just a very small portion of the research that we do. But we have access to clinical trials now. In the past year, we've opened, I believe, 10 or 15 cancer-related clinical trials at CAP region. And even though our cancer program is so new, these past year, we've actually accrued the most patients in our sort of NRG network at University of Maryland at CAP region, because it's important to have those clinical trial options brought into our community where you don't have to travel to DC or Baltimore to have access to them. So that's something that I very strongly believe in, and we've already established that relationship, and we will continue to bring these clinical trial options to our patients.
Great, thank you.
No problem.
Delegate McCaskill.
Thank you, Madam Chair. Thank you for such an impressive panel. Thank you, Delegate Harrison, ditto. Me too, to the kind comments from colleague Spiegel. But I want to refer to Dr. Jamie Brown at the end, because I felt like I knew you from somewhere. And you giving your presentation, it dawned on me that about 17 years ago, you actually performed my father's open heart surgery in your team. And so I just want to say thank you, although he has passed, not due to heart complications for sure, but it was your team who gave my family hope and allowed us to think and know that we could stay at another day with my dad. So it is heartwarming and chilling at the same time to see that you are still practicing giving families such hope. So I just want to say thank you.
Oh my gosh, yeah, that's beautiful. Thank you for sharing that. And thank you, Dr. Brown.
Thank you.
Are there any other questions?
And if I might just.
Of course.
I'm sorry, and I don't want to delay this, but I was on the Dimensions Board as a member of the Prince George's County Council. Along with, behind me is Bradford Seaman, who is the administrator. He's one of the top people at the hospital right now, but we were on the board, and we worked hard to get Dr. Jamie Brown, and it really has helped. You heard our statistics, and they just historically have not been good. And as Delegate McCaskill says, our community now has hope because of our new cancer center, which is what, 2 years old? 2 years old. We have a sickle cell program now, and we have the highest rates of sickle cell. And historically, most people in our area have had to go to Howard University to get their treatment. And they don't have to do that now. They can stay in their county. And our NICU is one of the best as well. And so we have great stories. And we have to tell our story, and allowing this funding to continue helps us to do that and bring people closer to home so that when they are ill, their loved ones can get to them, and they do have that comfort, which helps them to leave the hospital and stay out of the hospital, hopefully not to have repeat stays. So thank you so much. I appreciate you, colleagues.
We appreciate you and your leadership. Thank you so much to all the physicians. And I see a question, Delegate Tolles.
Thank you, Delegate Acting Chair. I would be remiss if I didn't just work closely with in the past. I want to just thank you all for being here, for your stories. Thank you to my colleague, Delegate Harrison, for bringing it forward. I would be remiss for those who are listening. I appreciate the work that does. They do represent District 20. I mean, they are in District 25, but they service so much of Prince George's County. We border District 24, and so I just want to thank you for bringing your stories here to this committee, and folks do listen. And so they can hear for themselves the work that is being done, because oftentimes people just say, oh, this didn't work out, the wait times or some other issues. They don't realize some of the great work that is done and the lives that are being saved. So I just wanted to thank you.
And the wait times have gotten better as well. The biggest problem is that we don't have the beds when we need to when people need to go inpatient. So,
well, we did a lot of work when we was on the council together to even bring this facility to Prince George's County and to expand that with spread semen. And so we still work to do. I think this will be helpful in moving us in the right direction. So thank you, Delegate Harris.
Thank you.
Thank you.
Are there any other questions? Okay, son. You're good. You're fine. Okay. Thank you to the panel. And also, I was very encouraged to hear about your food as medicine work. I'm closer to that work in Baltimore City, so great to hear that it's happening down in Prince George's County. There are no other witnesses, so that concludes the bill hearing for HB 1540. Thank you.
Thank you.
The next bill we'll be hearing is Delegate Simmons, 1505.
Good morning, Chair and the distinguished committee members,
Yes.
Delegate Gary Simmons,
Welcome.
District 12B, on House Bill 1505. It is a straightforward but meaningful step towards strengthening Maryland public safety workforce. This bill expands Maryland police officers and probation agents scholarship program and the loan assistance repayment program to include correctional officers, ensuring that they have access to the same educational opportunities and loan repayment assistance currently available to police officers and probation agents. Furthermore, this bill promotes equity and consistency within the Maryland public safety workforce. For those reasons, HB 1505 represents a thoughtful, low-cost policy that supports workforce development, strengthening public safety institutions, and invest in the professionalism who's helped maintain order and security in the correctional facilities. I respectfully urge the committee to give HB 1505 a favorable report.
Thank you so much for your testimony. I know there are no other witnesses. Are there any questions for the good delegate? Seeing none, thank you for your advocacy today. That concludes the bill hearing for House Bill 1505. There's one last bill hearing. Is someone trying to? She's on her way. Delegate Rose is on the way. And that will also be another bill hearing that will be delegate only. So if you indulge us just a couple of minutes, she's on her way. And the final bill of the day, Delegate Rose, House Bill 976, sponsor only.
Thank you, Madam Chair. For the record, Delegate April Rose here to present House Bill 976. I appreciate the opportunity to bring this bill to you. I've had this bill in a couple years in a row in a different iteration, and so I'm still working on something that will make a lot of sense both for the taxpayer and for families in the state of Maryland. There's been numerous news reports that the number of students who fit into a category of whereabouts unknown, which are now W50s, it started out when we started talking about this bill, about 6,126 children. Fast forward to 2024, it had grown to close to 11,000. And last year's numbers have come in, and it has it just over 7,000. And so my concern and what I've been trying to do twofold with this bill is, number one, come up with a better way of, in the formula for the blueprint, to find a way to count students more than one time. When you take a snapshot one time a year, we don't know what has happened to a lot of these students between September and the end of the year. I put the bill in this year rather than counting it 4 times, as in an attempt to be a little bit more reasonable as far as the burden of tracking all of these numbers, is I changed it to 2 years. I did put May 31st. I did have some very good conversations with the Maryland State Department of Education, and I really appreciate their time to go over things with me and educate me as well. And I know that that could be a problematic date, so I am willing to change that date maybe till the end of March. That will be at a 6-month mark. And again, if we are really looking at where kids are and making sure, having served in Ways and Means together with Madam Chair, we have such great services available to students in need and their families. And so in addition to certainly being a better steward of taxpayer dollars, I hope we can find where these kids might be if they need help and make sure that they're in school. So I know that they say it's a little bit burdensome. I know that California, Massachusetts, and New Jersey, they do a daily count, and they use that in their formulas. So I know there's never probably a perfect way of doing it, but my hope is that we can have a good conversation and come up with a better way of funding our kids and finding our kids. Thank you.
Thank you, Delegate, for your testimony and for your compassion on this issue. Are there any questions for the good delegate? Seeing none, thank you again for making it here. We waited.
I'm sorry.
No, I locked the doors. I'm just joking. But no, thank you for being here. And that concludes the bill hearing for House Bill 976 and the budget hearing, the bill hearings for today.
You saved me from dogs, so.